Continuing coverage of ASCO 2011 here on Oncology.TV. Joining us now, Dr. Purna Kurkure. She is professor and head of Pediatric Oncology at Tata Memorial Hospital, a government hospital in India. Thanks for joining us.
Thank you.
Let's talk about the abstract that you presented here at ASCO.
I have presented abstract on childhood cancer survivors and the challenges that they face, and entitled my abstract as Surviving Childhood Cancer, What Next? This tells about the late effect clinic that we have at my hospital, Tata Memorial Hospital in Mumbai, which is a tertiary cancer care center.
What were your findings with this study?
We have followed up our survivors in this clinic, and from February 1991 to February 2011, I have enrolled 1201 long-term survivors of childhood cancer in this clinic. The striking features of my findings are that there is a male preponderance of 3:1, indicating differential treatment to a male child in our society. A male child is brought to the hospital, is given all the care and treatment, and therefore that is why they are better survivors, and this is a preferential treatment to male child in our society in general. We have also the documented late effects. It's encouraging to see that as much as 46% of these survivors are normal, and another 28% are just having a mild or moderate late effects. 21% has a major late effects, and 5% have a very life-threatening sequelae. So all in all, 1/4 of them, they require a lot of attention, and 3/4 do require a follow-up, but not that much of a close attention.
So this study was done with your hospital, but you also modeled and worked closely with St. Jude's Hospital in Tennessee here in the U.S. How did that come about?
In 1990, I came as a visiting professor to St. Jude Children's Research Hospital, which is well-known Pediatric Oncology Center for USA. And my aim was to mainly look at this model of how to set up a late effect clinic. And I learned that by having a hands-on experience for 6 weeks at St. Jude. And then I took that concept back and started the same clinic in 1991, soon after my return.
So based on your research and results, what are your recommendations now for treating children in India with cancer?
Childhood cancer survivors, as we all know, they require a lifelong follow-up and vigilance screening, and this is particularly a challenge in developing country, where there is a lot of pressure and no system to get them back for follow-up again and again. And that is why the recommendation would be that all the pediatric oncology centers in developing countries also need to think about this late effect surveillance program right at the beginning and pay attention to this basic requirement. I am currently the late effect and survivorship task force convener for pediatric oncology in developing country committee of COP, that is the International Society of Pediatric Oncology, and I am going to take up the same issue through that task force or working group to take this momentum forward.
Dr. Kurkure, thank you for stopping by. Best of luck in helping the children of India and families of children in India battling cancer.
Thank you very much.
Dr. Purna Kurkure, she is professor and head of pediatric oncology at Tata Memorial Hospital in Mumbai.